Verify and check the doctor's order to know the patient, the site of affection, and to check the weights to be used.
Good morning, ma'am.
Inform the patient about the need and purpose of the procedure to allay patient's anxiety and to elicit cooperation.
Next, gather the equipments needed for BST. The Thomas splint, person's attachment, rest splint, 3 cord or ropes, baller bronze splint, 5 slings, 5 safety pins, 3 pulleys, weights, Steinman spin holder, footboard, and overhead trapeze.
Assemble the Thomas splint and person's attachment. Estimate and measure the length of the thigh to ensure the person is in line with the knee. The person's attachment must be under the Thomas splint. Mount the Thomas and Pearsons on the rest splint.
Apply the slings. Start from the medial side to the lateral side. Secure both ends together. Unfold nicely on the lateral aspect and secure with a pin or clip. Observe the principles in sling application. N1 PS2. Not too tight and not too loose. 1 inch distance in between the slings to promote aeration or ventilation. Popliteal area and heel portion should be free from any slings. Smooth and right side should come in contact with the patient's skin to avoid friction and irritation. 2 longer and wider slings from the side portion or the Thomas and the 3 for the leg area.
Tie the tie rope, the shortest, on the medial upright of the Thomas with a slip knot and secure the other end of the rope at the screw of the Pearson.
Insertion of the apparatus under the affected extremity. 3 manpower needed.
Check if the principles of sling application are followed. Check the alignment and make necessary adjustments. Adjust also the person's attachment if not aligned with the patient's knee.
Application of the traction weight. One end of the traction rope, the longer rope, is attached to the Steinman pin holder with a slip knot. The other end is to run along the third pulley. Attach the prescribed weight.
Application of suspension weight. The loose end of the tie rope is attached to the lateral aspect of the ischial ring with a slip knot. Attach suspension rope, which is the longest, at the mid part of the tie rope with a slip knot. Insert the end of the suspension rope to the first pulley. Insert the suspension weight and hang it on the first pulley. Then insert the suspension rope to the second pulley, then pass it under the rest splint outside the traction rope. Tie it to the Thomas splint with a clove hitch knot and tie it again to the person's attachment with another clove hitch knot. Then consume the remaining rope.
Remove the rest splint.
Apply footboard using the ribbon knot to prevent foot drop. Check the efficiency of the traction by swinging the patient to and fro, side to side.
Check the principles of traction. Number 1. Patient should be in dorsal recumbent position. Number 2. Provide counter traction. The patient's body weight will serve as the counter traction. Number 3. The line of pull should be in line with the deformity. First pulley should be in line with the thigh. Second pulley should be in line with the knee, and third pulley should be in line with the first and second pulleys. Number 4. Traction should always be continuous. Importance of manual traction should be emphasized.
Check the doctor's order.
Explain the procedure to the patient.
Apply the rest splint.
Hang the suspension weight on the first pulley.
Completely remove the suspension rope.
Loosen the tie rope on the lateral aspect of the ischial ring and secure the loose end on the screw of the piercings. Remove the traction weight.
Remove the traction rope from the third pulley and secure the loose end on the rest splint with a clove hitch nut, another nut on the Thomas and the person attachment.